Snoring. It's the unwelcome guest at bedtime, the noisy roommate that disrupts our sleep and our partners. But what exactly is this nighttime nuisance? Simply put, snoring is the vibrating sound produced in our throats when we breathe during sleep. As we drift off, our muscles relax, including those in our throat. This relaxation narrows the airway, and as we breathe in, the air rushes past these relaxed tissues, causing them to vibrate. These vibrations create the familiar and often annoying sounds of snoring. Snoring can range from a soft rumble to a loud rattling sound that echoes through the bedroom. While occasional snoring might be harmless, persistent snoring can be a sign of an underlying health issue and should not be ignored. If you find yourself or your partner dreading bedtime because of snoring, remember that you are not alone. Millions of people experience snoring, and thankfully, there are ways to address it and reclaim peaceful sleep. Snoring can be caused by a variety of factors, and understanding these causes is the first step toward finding a solution. One common culprit is our anatomy. Some people are simply predisposed to snoring due to the structure of their mouth, nose, or throat. For example, a deviated septum, which is a crooked wall between the nostrils, can obstruct airflow and contribute to snoring. Another factor is nasal congestion. When we have a cold or allergies, our nasal passages become inflamed and swollen, making it harder for air to flow freely. This obstruction can cause us to breathe through our mouths, leading to snoring. Obesity is another significant contributor to snoring. Excess weight, especially around the neck area, can put pressure on the airway, narrowing it and increasing the likelihood of snoring. Lifestyle choices can also play a role. Smoking, for example, irritates the lining of the throat and nasal passages, contributing to inflammation and snoring. Alcohol consumption is another culprit. While a nightcap might seem relaxing, alcohol actually relaxes the throat muscles even further, making snoring more likely. By understanding the causes of snoring, we can start to identify potential solutions and work towards quieter, more restful nights. The good news is that there are many practical steps you can take to quiet the nightly symphony of snores and improve your sleep quality. One of the simplest yet most effective strategies is to establish a regular sleep schedule. Aim for 7 to 9 hours of quality sleep each night and try to go to bed and wake up around the same time every day, even on weekends. Maintaining a healthy weight can also make a big difference. Even a small amount of weight loss can reduce fatty tissue in the throat, opening up the airway and reducing snoring. Incorporate regular exercise into your routine and focus on a balanced diet rich in fruits, vegetables, and whole grains. If nasal congestion is a culprit, address it head-on. Using a humidifier in your bedroom can add moisture to the air, helping to shrink swollen nasal passages. Saline nasal sprays or rinses can also be effective in clearing out congestion and promoting easier breathing. By making these lifestyle changes, you can create a more conducive environment for peaceful sleep and reduce the likelihood of snoring. While preventing snoring is ideal, there are also ways to manage it and minimize its impact on both you and your partner's sleep. If you're the snorer, consider positional therapy. Sleeping on your side, rather than your back, can help to keep your airway open and reduce snoring. You can try sewing a tennis ball to the back of your pajamas to discourage back sleeping. For partners of snorers, earplugs can be a lifesaver, literally. They effectively block out the noise, allowing for undisturbed sleep. White noise machines or fans can also help to mask the sound of snoring, creating a more soothing sleep environment. Open and honest communication is crucial. If snoring is severe or persistent, it's essential to consult a healthcare professional. They can help to rule out any underlying medical conditions and recommend appropriate treatment options, which may include lifestyle modifications, dental devices, or in some cases, surgery. Remember, peaceful sleep is attainable for both snorers and their partners.